This morning, reaction continues after it was announced former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has spread to his bones. About 1 in 8 men will be diagnosed with prostate cancer during their lifetime. According to the American Cancer Society, it's the second most common cancer in men after skin cancer. The former president and his family are reviewing treatment options with his physician. This morning, we have Dr. Zachary Guss, a radiation oncologist with MultiCare, joining us in studio. Dr. Guss, thanks so much for being here with us. I want to start things off first by saying you're not the president's doctor, but you do have a history with this. You understand it. Can you give us an idea when we hear an aggressive form of prostate cancer? Give us a scope of kind of what that means.
Absolutely. Well, first, thanks so much for having me here, Tim. It's great to be here. When people say aggressive prostate cancer, it can mean slightly different things. In this situation, we're talking about a prostate cancer that has left the prostate gland itself and spread to the bones. So some people may refer to this as either metastatic or stage 4. It is very serious. It is incurable, but it is highly treatable. And so many men will live for years with this diagnosis with successful treatment.
And tell us a little bit more about the Gleason score. We've been hearing about the Gleason score of a stage 9. Is that the correct way? It's called stage 9 in President Biden. Give us a kind of a scope of the range of the Gleason score and what that means.
Absolutely. So the Gleason score can be a little confusing, but effectively it refers to what the pathologist sees, let's say on a prostate biopsy or a surgical specimen. And the pathologist will give a couple scores depending on how aggressive the cancer looks under the microscope. Now, historically, we called this a Gleason score, and it was based off of a 6 to 10. That got a little confusing, so more recently we've been using something called a grade group, which would simplify everything from 1 to 5, with a 9 being a 5, or the most aggressive category.
I heard you say that this is still highly treatable given his diagnosis, but tell us, what are treatment options if someone should get a diagnosis of any score? What are their options?
So prostate cancer is highly variable, so we want to pair the right treatment and whether to treat at all with the aggressiveness of the cancer as well as the health of the patient. So for example, you don't want to throw the kitchen sink after a prostate cancer that might not cause somebody any problems in his lifetime. In that case, we might just keep an eye on things with monitoring. But for something more aggressive where it's spread to other parts of the body, it often includes hormone therapy and sometimes chemotherapy, radiation therapy, which is my specialty, can also be used. And when it's more localized just in the prostate, oftentimes surgery is used to address the cancer.
So I do want to back up though and talk about screening. I think, you know, this making the news is kind of reinvigorating the conversation around screening and men's health. So tell us more about screening. This does specifically impact men. So tell us more about screening. When should people get screened?
It's a fantastic question. Now, screening for prostate cancer has been somewhat controversial in recent years. And the reason is that more men die with prostate cancer than of prostate cancer. However, because it's so common and some are very aggressive, there are still about 35,000 men per year dying of prostate cancer. And so what we recommend is for men who are about 45 to 70, unless you have special factors that might bring into consideration to screen earlier, having a conversation with your primary care physician and discussing whether or not this fits in with your goals of care.
All right. And how can people, if they want more information on prostate health, how can they reach out to MultiCare?
They can reach out to MultiCare as well as the American Urological Association. There are a lot of great resources out there, and I encourage them to speak with their primary care provider.
All right. Dr. Guss with MultiCare joining us here in studio. Thanks so much for being here.
Great to be here. Thanks so much, Tim.